Recently, the hospital board of directors selected J.E. Dunn to be our construction manager and also our general contractor for the hospital expansion project. So we put out a request for qualifications, and we did get back 7 different companies that had the qualifications to be able to bid the project, and we went through and narrowed that list down. Then we did a request for proposal for their services and compared 3 vendors. They came and gave presentations to a 9-member selection committee that included members of our board and our leadership team and our construction team and our architects, HMN. And so after looking at both their qualifications and their pricing proposal for their services, we ended up selecting J.E. Dunn and recommending that to the board. Then the board formally approved that right after that committee recommendation. We were really impressed with the level of experience they brought to building hospitals this size and even larger. This would be considered a mid-size project for them. And one thing that they had that maybe the others didn't was the local representation. They've got a significant part of the Springfield market. They had individuals that are going to be on our project team that are local, that know CMH, they know the services we provide. So that really stood out to me, along with the fact that also their pricing was more favorable. So we kind of got the best of both aspects of that. J.E. Dunn is working with our design team to look at where we're at with design development right now, and then putting some real current day costs on this project. A lot's changed in the building environment in the last couple of years, and so we had some escalation built in, but now what they're doing is using their experience and cost that they've experienced in their market and applying that to our building and seeing where we can do some value engineering to be able to get the project within the scope of our budget, or let us know how much additional resources we're going to need for the project. So they're working on a full project cost, and then they'll deliver to us what's referred to as a guaranteed maximum price. It's the price that they guarantee they can deliver the building for. When they deliver us the GMP, it's going to get us ready for construction. We'll go ahead and start then our make-ready projects, which are things that have to happen in order for construction to begin. So the cafeteria is going to have to move for the construction to begin. Some office space that's currently in the building just adjacent to the hospital, that building's going to come down. So some of those offices are going to have to be moved into other space that we're going to have to make ready for them. There's some site utility things that have to happen before we get going with construction. You know, this part of the project might actually seem somewhat slow because we're going through every item, applying cost to it, seeing what options we have. But rest assured, there's a lot of work going on in the background to get ready for groundbreaking and construction. It's a very big project, but we've got the right people on the team. We've done a good job of soliciting feedback from our healthcare providers and from our staff. And so all that together is going to make this a really successful project. We're excited to get to groundbreaking. We've got some work to do between now and then, but I know we'll all be excited to get the project started.